My name is Allison. I'm a psychologist. My ethical dilemma was when I was a new psychologist, I had a case where a mother came to me with a very difficult marriage and a 13-year-old daughter. The husband, who had some severe mental issues, mental illness, was occasionally hitting the daughter, supposedly for whatever transgression she had committed. And of course, the more he would hit her, the more rebellious she would become. So it was a vicious circle. The mother came to me for help in trying to help her marriage and as well as the family situation. Well, as a psychologist, I'm a mandated reporter legally for any kind of child abuse. Even if it's just suspected child abuse, I'm mandated to report that. But I had never done that before, and I had my doubts as to whether it was the right thing to do. Now, of course, looking back on it, this should not have even been a question in my mind. But because this mother had come to me for help, had confided in me the difficulties in her home, how unstable her husband was, I felt really, in my core, like a real rat for really telling on this family, going back to that feeling like a child that you're tattling on somebody. So the first thing I did was, of course, try to get the family to improve their situation, and that wasn't going to work due to the severity of this man's instability. I consulted an attorney who works with psychologist who was exasperated with me, and he said, of course you have to report this abuse. There's no question about it. Call Albany and report it. I still felt uncomfortable doing it, again, because I felt that I was somehow betraying this mom who had put her trust in me, and I felt that by reporting the abuse, somehow I might make things more difficult in the home. And just that sense of betraying a woman who had trusted me to help, and that I was blowing the whistle on the family. So the second thing I did was seek supervision from a more experienced psychologist who did not tell me what to do, but he pointed out to me that if I did not report this abuse, I was really what he called joining the family system, complicit in helping to cover up what was going on. And I was part of the denial and cover-up of the abuse in this family. And, you know, sometimes the way a person says something makes all the difference. That definitely made me realize that he was absolutely right. I was perpetuating the problem by not blowing the whistle on it. So at that point, my decision was really clear, and I called the Child Protective Services in Albany. And they could not have been nicer and more professional, more supportive of my dilemma, but they took all the information and took it over from there. I saw the family a few times subsequent to that phone call. They did not stay with me, and I don't know really what the outcome was, but I do know that the Child Protective Services intervened on some level, although the family did not remain in counseling with me. I think there was an improvement, at least in the physical abuse of the child, of the 13-year-old girl. The point of my story is this, that sometimes, even though it's totally clear what the right thing is to do, it's not so totally clear. It's totally clear in the ethics of my profession as a psychologist. It's totally clear in the laws of New York State as a mandated reporter. And it's totally clear in the common sense eyes of anybody that if you see abuse or even suspect abuse, that you should report it. But it was really not so clear to me, given sort of the other side of the coin, that I was breaking confidentiality and worried that perhaps this might actually even make the situation worse for the patient, the mom. And that inner sense, this gut feeling I had of betrayal of her confidence in me. So it really was not so easy. So clear-cut things aren't always so clear-cut. I guess if they were, we would always all do the right thing at all times. And the second point of it was that it did get easier. Fortunately, I haven't had too many cases like this But the next time I had to make this decision to call Child Protective Services, it was not such a difficult decision. It was pretty clear this is what I needed to do. I told the family that I would do it, and I did it. So doing the right thing maybe gets easier with practice. That's it. Thank you for your time.